Welcome to Act Early, Save Life, a special podcast series where we speak with leading cancer specialists to raise awareness and empower early action. In today's episode, we're joined by Dr. Niti Raizada, Principal Director, Medical Oncology and Hemato-Oncology from Bengaluru, to help understand gastric cancer, its warning signs, risks, and the steps we can take for early detection and prevention. Thank you so much for joining us, Dr. Niti.
Thanks for inviting me.
So I want to start by asking you, what is gastric cancer and why is it a concern for public health?
See, stomach is gastric. Now, stomach is the area where we preserve or store food while in transit, and when there is uncontrolled growth of the lining of the gastric wall, or there's ulceration for various reasons, which becomes uncontrolled, this is known as gastric cancer. Gastric cancer happens to be a very important cancer, especially in our context of India. So South Asia and East Asia, this is one of the leading causes of cancer. And there's also a cancer which does not have many signs and symptoms. So it goes undiagnosed for a long period of time. And when the patient actually comes to the hospital, it's kind of pretty advanced. So it's very important to understand that awareness is what we can do to fix it at the right time.
So you had mentioned that there are more prominent cases in South Asia. Why is that so?
Every time when we talk about any cancer, we have to remember it's multifactorial. So there's no one factor we can define, but in South Asia and East Asia, again, there are mostly some dietary factors which are very prominent. Not just that, there are hereditary factors which are very prominent. So in certain parts of East Asia, there are familial gastric cancers defined which run in the family, even in India. So we also do molecular typing to find out which are these high-risk families and also do further testing on them.
What are the early warning signs of gastric cancer and why are they often overlooked?
One important question you asked is why they are overlooked. Yes, most of the signs and symptoms of gastric cancer are overlooked because often patients will actually have just indigestion, which is lasting for a very long time. They may occasionally have vomiting or persistent nausea. They may have non-specific weight loss, which they don't know what's happening. An advanced case may actually have just abdominal fullness. So all the symptoms which I spoke to you are very non-specific symptoms.
But they're also cancer symptoms.
If they persist for a long time, they could actually be cancer. Just working up for anemia for a long time. It could be just low hemoglobin, patient is having fatigue and tiredness, and then actually evaluate, you find that stool has occult blood and was actually a gastric ulcer which was bleeding. So that's the reason, because there are such non-specific symptoms that they go undiagnosed. And what we can do is, if there are any non-specific symptoms which have been persistent, then go to a doctor. They may want to evaluate and they may actually focus on the stomach and find out that there was actually a gastric cancer which was undiagnosed.
Okay. Is gastric cancer hereditary?
We started by discussing this question. Yes, hereditary gastric cancer is also an entity known, but it's less than 10%. Okay. 90% would be other factors, but approximately 10% are the patients who could have gastric cancer as hereditary. So there is hereditary gastric cancer. There could be some syndromes like breast and gastric cancer. The family would not have gastric cancer, but they could have breast cancer. So there are hereditary cancer syndromes, and gastric cancer has entity which also defines a mutation, a high-risk mutation, and therefore those families are at risk of developing cancer.
Okay. So is there a particular age group that is at higher risk for gastric cancer?
Let's start with the risk factors. Well, the most common risk factor for like other cancers is just tobacco and alcohol.
Yeah.
And when we take both of them, it's worse. That is one. Then chronic indigestion can actually cause chronic inflammation, which can lead to cancer. Certain type of infections like H. pylori infection. We all know about H. pylori. So even chronic H. pylori infection can cause. No, not just that, there are certain type of food which again certain cultural background have more propensity to take, especially processed food, smoked food, pickled food, salted food. These are some food, they also have certain contaminants and certain things which are added in them, additives, which can actually increase the risk of gastric cancer.
How does chronic stomach inflammation or gastritis progress to cancer, and what can be done to prevent it?
Gayatri, the important question is chronic inflammation in general is an etiology for cancer. So anything which has been persistent, if I have a chronic tooth irritation, it can actually lead to a tongue ulcer and can cause tongue cancer. Similarly, if there's a chronic irritation in any part of the body, if there's a bladder inflammation, it can cause cystitis and can actually cause urinary bladder cancer. Similarly, a chronic inflammation in the stomach can cause cancer by actually causing, there's a stimulus which makes the cells grow, and that could be an aberrant growth which can actually lead to cancer. So identifying any chronic symptoms like chronic indigestion, there is this non-specific stomach pain, sometimes non-specific back pain, upper back pain, or there is always belching you are having, or again, as I said, weight loss. These all things should bring you to center around stomach, and then this chronic inflammation, which could be the result of chronic infection, or again, there could be a chronic reflux. These all could actually lead to chronic inflammation causing cancer.
And is there anything that can be done to prevent this?
Identifying things at the right time. So if it's diagnosed at the stage of esophagitis, where the lower esophagus is chronically inflamed, or gastritis, where the stomach wall is chronically inflamed, we know about it, identify the factors. There are some food factors we could actually remove. If there's an infection, we can work on treating the infection that could actually prevent cancer.
Are there any foods that would predispose a person to gastric cancer?
Yes, smoked food, pickled food, salted food, of course, processed food. These are some food which definitely have shown to be associated. Then there are certain contaminants like nitrates, nitrites, nitrosamines, which are added to processed food like red meat. For keeping them for a longer time, there would be these adulterants, additives which are added. These have a high propensity to develop gastric cancer. So identifying food items, especially consuming fresh food, especially rich in fruits and vegetables. Okay. This is the key.
But it also depends on how much you consume of the food.
Absolutely.
It's not like a
yes, one-time exposure may not lead to anything, but a chronic constant exposure may definitely increase your risk.
What practical steps can the public take to reduce their risk of gastric cancer?
So what we can do in terms of lifestyle, yes, as I said, first thing is that increase your supply of fruits and vegetables. Have as often as possible. Wherever possible, avoid processed food. Wherever possible, avoid red meat. Have a lifestyle which is generally fit. So make sure that you are doing certain kind of at least some exercises each day, or at least most of the week. Maybe 30-40 minutes each day is what you can do. So these are some basic lifestyle things. Of course, the next important thing is whatever addictions you can stop. So alcohol and smoking, we definitely know is an important reason of developing gastric cancer as well. So wherever possible, go to a program which can actually make you kind of come off these addictions if it is you're not motivated enough yourself. So a psychologist or a therapist who can actually help you out of it is the next step you can take. And wherever possible, avoid processed food.
Why is early screening and prompt medical attention so important for gastric cancer?
Most of the gastric cancers are diagnosed late. Unfortunately, because of they don't red flag with signs and symptoms, so they often diagnose late when they are already spread. And where they are spread are omentum, peritoneum, liver. And that's when they are not treatable or not curable. They are treatable but not curable. So diagnosing them at the right time is the key. Where we can actually screen are the individuals who have a strong family history. Now we know that they have a strong family history and you have done a genetic charting. You probably have seen whether they have a high-risk mutations. So you can do a screening scopies. An upper GI endoscopy screening is recommended for these high-risk population. Second thing is, if you already have a history of chronic gastritis, then you will be put on a screening program. If there is already a risk factor, like you have an addiction which makes you have a problem, or you already have a hiatus hernia with a chronic reflux, these are certain patients who would require regular screening. And if not a screening endoscopy, at least visit to a doctor if there are unexplained symptoms like weight loss or chronic fatigue, which could be a consequence of anemia. Go to a doctor early to get yourselves checked.
Okay, and is there a particular age group that is of higher risk for gastric cancer?
All cancers happen in older individuals. 50 and above, if there are any persistent symptoms, they definitely should visit a doctor. However, if the symptoms are persistent in a younger individual as well, especially in hereditary cancers, they happen pretty early. They can happen in your 20s and 30s as well. So yes, most important risk factor is age, but younger age with persistent symptoms also require checkup.
Okay. How does a multidisciplinary medical team improve the care and outcome for gastric cancer patients?
Oh, it's a very good question, because not just in gastric cancer, in any cancer, the way we function is multidisciplinary team. What does it mean? Any cancer is always treated by multimodality management. It's not just treated by one specialist. The specialist when we treat cancer could be a medical oncologist, a surgical oncologist who would perform surgery, a radiation oncologist who actually can give radiation to the tumor. And then, of course, there are nuclear medicine specialists, there are oncoradiologists, oncopathologists who can tell what's the subvariant or the subtype of cancer. And then even geneticists who will actually do genetic profiling and testing. So all these are regularly required for even gastric cancer, because an early stage cancer may require more than one modality. So you may actually start with chemotherapy, do surgery, and then give subsequent chemotherapy. In a rare case, we may do chemotherapy, surgery, and then radiation. For palliative reason, we may give newer therapies like biologic therapies, immunotherapies. So multimodality gets the right inputs. At the same time, we have an oncopathologist who tells us this is a different variant and you may require a different treatment. A geneticist or a tumor biologist may tell us that this is the pathway and we actually can perform better if we do a certain thing. So multimodality management is the way for any cancer, especially gastric cancer.
How fast does stomach cancer spread?
It's a very aggressive cancer. So if I have to talk about cancers in general, there are certain cancers which are described as highly aggressive cancer, and gastric cancer and hepatopancreaticobiliary cancer are two subsets which are very aggressive.
Can gastric cancer be cured or treated?
It can be treated. Any stage treatment is possible, whether it's early stage, whether it's locally advanced stage, or it is metastatic, which is stage 4. Why is treatment important? Because at any stage, early stage, it's curative. So your next question was whether it's curative. Early stages are curative, and that's the reason we are having this conversation, to diagnose a patient on time. Locally advanced also, substantial number of patients are curable, can be treated with curative intent. Now, when we are treating an advanced cancer, sometimes the intent is not always cure. But if there is suffering related to cancer, let's say I have a recurrent ascites and recurrent fluid collection which makes me very restless. If I have significant pains because of spread in certain areas which can cause pain, if I have continuous bleeding, like vomiting blood or bringing out blood in stools, it causes severe symptoms. So here you are managing for symptoms. So you are doing symptom control, pain management, trying to improve quality of life, and at the same time increase longevity, at least to some extent. So every time there is a different objective of treatment. So we have to identify the right patient for right kind of intent. Early cancers, curative intent. Locally advanced, potentially curative intent. And advanced cancer, at least to make sure the quality of life is preserved, and then of course survival improves.
You had mentioned about game changer therapy earlier. What are the game changer therapies in gastric cancer?
That's actually a very useful question, especially in the context of a person already who has gastric cancer. So, well, often patients of gastric cancer present in advanced stage. That's a sad truth. But yes, there are game changer therapies now, again based on molecular characteristics. So one important therapy is Claudin 18.2 based therapy known as zolbetuximab, which is again a targeted agent which is given if a certain population express this marker. Besides this, obviously there are immunotherapies. Now immunotherapies are immunity modifying agent, for which in gastric cancer we require certain markers to be expressed when we can do it. And these act as monoclonal antibodies to modify your own immunity to fight cancer, sometimes given as a single agent, or it can be given in combination with other agents like another biologic therapy, or often with chemotherapy combination.
What is the role of precision local therapy in gastric cancer?
Local therapy are generally two types of important therapies in cancer. This could be either surgery or could be radiation. So when we talk about precision surgeries, they are more minimalistic surgeries. You would want to retain the healthy parts and remove the structures which are involved. But when we are actually doing the surgery, we have to see that adequate lymph nodes have been removed, margin status has been achieved. With newer therapies, minimal access surgeries, which are known as precision surgeries, it has been able to get better and better results with minimal loss of healthy tissue. When we talk about precision radiation, they are again more and more focused radiation, which only acts on the target tissue and where we want to achieve good control without causing long-term side effects to the healthy tissue.
Okay, so this is all used in earlier stages, or it
This
can
is
be
generally
used.
used in earlier stages, but what we have, because early stage are curative stage and we don't want long-term side effects. So when we use these precision techniques, we are making sure that only what is required to be salvaged is sacrificed, whereas the normal healthy tissues are saved.
Okay. What are the AI-based diagnostics in gastric cancer?
AI is an integral part of any area of oncology or hematology now. And AI-based diagnostics is actually achieving, has a significant role when we do screening programs. So there is known as AI-based endoscopies, which are widely practiced in countries like Japan and South Korea, where we actually localize high-risk areas, keep them in follow-up, or wherever required do biopsies, because these countries actually run a preventive screening programs for gastric cancer because they are high risk population. As I said, East Asia and South Asia are areas, pockets of gastric cancer as well. So they actually run AI based diagnostics. The other aspect of AI based diagnostics is that we have huge number of data in our areas in oncology. And there are so many metabolomics data, there are microbiomics data, there's transcriptomics data, and of course genomic data. All of it needs to be integrated. And now how to make it functional is that you integrate it with machine learning, bring out useful points, and that you can incorporate in an AI diagnostic tool, which we all have started doing. There are also certain predictive markers which makes a certain population high risk to decide whether they may actually get cancer or not.
So when a patient already has gastric cancer, what is your advice on nutrition for them?
A very interesting question, because sarcopenia, which is weight loss, which is related to treatment, is actually a bad sign. Cancer-related cachexias are bad sign. So we normally calculate the basic, what was the initial body weight and what was the body weight loss during the treatment. And that has an important bearing on the outcome as well. So it's very important to realize that while the patient is on treatment for gastric cancer, their digestive system is impaired. So during this time, the nutritionist, onco-nutritionist is the most important member who can actually titrate treatment in such a way, titrate nutrition in such a way that they may actually not like what they're already taking, but whatever food, whatever supplements have been given, take care of the energy requirement and also make them not lose weight during this time. So proteins are supplemented. Natural source of vitamins and minerals like vegetables and fruits are what is given. Carbs could be there because you also need instant source of energy, but then the redistribution of calories with higher proteins, most of it otherwise fruits and vegetables, restricting on certain type of fats, and then wherever required, give energy supplements.
And I want to end by asking you, what is CAR T cell therapy in gastric cancer?
CAR T cell is chimeric antigen receptor T cells, which are your modified T cell. If one person has cancer, then their tumor tissue is extracted, modified in a certain way outside, genetically engineered outside, and given back to you to fight cancer. This is the concept of CAR T cell. And this is already now in use in hematological malignancy, generally B cell malignancies and myeloma. But a lot of research has been there in solid cancers like breast, certain other type of cancers as well. And Claudin is one specific marker of CAR T cell in gastric cancer in which there's initial research. But at this juncture, it's not in clinical practice. But yes, in the next few years, we'll see CAR T in gastric cancer as well.
Okay. Thank you so much, Dr. Niti Krishna Raizada, for such an insightful and informative session on gastric cancer. That's all for today's episode of Act Early, Save Life. Stay tuned for more expert conversations that help you stay informed and proactive about your health. Thank you for watching.